Dr. Buchelman. Today we have a little bit of good news for parents. 27,000 kids with juvenile idiopathic arthritis, followed for an average of 4 years, treated with TNF inhibitors, no signs of increased malignancy in this group.
Well, so we were able to follow 27,000 children using their administrative claims billing records and saw that among children with JIA, there was an increased rate of malignancy. It was about 2.5 times the rate seen in the general population. But then among 3,300 children who took TNF inhibitors, we didn't see an additional increased rate above that. So the rate seen in children who received TNF inhibitors was the same as the rate seen in children who did not receive TNF inhibitors.
So what you're suggesting is that, I think something that's been known is that there is an increased risk of cancer in kids with this inflammatory disorder, but that the drugs don't expose them to any additional risk over top of that.
It appears that's what we're seeing, yes. There's, including this current study of ours, there's now several studies that have shown a 2 to 3-fold increased risk of malignancy associated with JIA itself. And our current study shows that adding a TNF inhibitor to that doesn't seem to increase the risk significantly.
So has there been a big concern about the effect of that drug on malignancies in kids?
Well, everyone was concerned initially, certainly, including the FDA, who issued a boxed warning in 2009 following voluntary reports of malignancy that they received from children that received TNF inhibitors, including children with JIA, but not exclusively. I think a lot of those concerns have been lessened with studies like this one, but it definitely has affected the way some people prescribe these medicines and how some families perceive them.
Your average follow-up was 4 years, but I think you said you had some children that you followed for up to 11 years. But is 4 years long enough for you to draw a conclusion like that?
Well, no one really knows for certain. Childhood cancer is thankfully very rare, but that makes it a very challenging thing to study for an epidemiologist. We will probably never have a 100% definitive answer to this question. But we do have, as you said, an average of 4 years of follow-up for children that took TNF inhibitors. The median follow-up was about 1.5 years. And if you look at the cancers that were reported to the FDA back in 2009, the median amount of exposure there was about 1.5 years also. So we're getting into the range where if there is an association or a causation, I think that we would be able to see it.
I guess I should, let's talk a little bit about, is this going to change prescribing at all, do you think?
Well, I hope studies like this will continue to lessen the concerns about malignancy. I personally think the study is very reassuring, and we know that the TNF inhibitors are highly effective for the treatment of JIA, and so personally I think it's best to focus on the positive aspects of these medicines, that they really are remarkable in treating arthritis for most children who take them.
So if there is a risk of malignancy that's sort of endemic along with the disease, is there any evidence in children that treating JIA well and suppressing that inflammatory response benefits their...
Well, many people believe that, myself included. There's no good data to support that in children. There was at least one study in adults with rheumatoid arthritis that showed a strong relationship between the level of disease activity and disease severity and the subsequent risk of lymphoma.